Hello guys, today we will talking about transfusiology. This is a very interesting topic and this is very important topic because now in the 21st century we have many indications for hemotransfusions, transfusions of the blood, and we have three reasons how you can come to prison. uh, First reason, it is a drugs, like morphine, cocaine in hospital, of course. Second, it is not management of patient or not right management of patient. And third one, it is a not right transfusiology. This is the reason why you need to be very attention. Transfusiology is a branch of medicine that deals with various aspects of blood transfusions, its components and blood substitutes. How you know, we have four different blood groups. Yeah, they are immunogenetic and individual signs of blood that unite people by the similarity of certain antigens, agglutinogens, but agglutinogens we use just in Russia, and now we finished with this one, and we talking just antigens and antibodies in red blood cells, and antibodies or agglutinins. Yeah, don't use agglutinins in the blood plasma. You can talk with me and tell just antigens, antibodies. And what you need to remember is that antibodies you will find in the plasma and antigens you will find in the red blood cells. When the same agglutinins, agglutinins, it is antibodies, and agglutinogens or antigens, we will call it antigens, interact, and agglutination glutamine reaction occurs. As a result of agglutination of erythrocytes and their subsequent hemolysis, a serious conditions occurs like transfusion shock. According to the presence of certain agglutinogens and agglutinins in the blood is divided into four groups and the system is AB0. There you see that we find antigens in erythrocytes. Yes, in first group we haven't got antigens. In second group, group A, we have antigens A, and this is the reason why we have 0, 1, A2, B3, AB4, because there are antigens. Yes, in the B you see 3, and AB you see in the fourth group. What about antibodies in the plasma? You see that in the first we have alpha and beta. In the second group we have beta, and the third group have alpha. Yeah, they change, and you need to remember that. In fourth group we haven't got antibodies. The determination of the blood type is based on the presence of an agglutination reaction. It is carried out using a standard serum containing known agglutinins, or how we call it now, antibodies. Standard blood serum of groups 1, 2, and 3 is applied to the plate drop by drop in two series. The examined blood is injected into them with a stick. The appearance of agglutination in serum indicates the presence of an agglutinogen, antigens of the same name in red blood cells. Maybe it's not understandable for you, but you can look the video. The link I will give you under this video, in the comments, and you will see there how it's happened. In addition to the main agglutinogens A and B, there may be others in red blood cells, in particular the so-called rhesus factor, which was first found in the blood of rhesus monkeys. Because it calls rhesus, because in the rhesus monkeys. By the presence of absence of the rhesus factor, rhesus positive, like 85% of people, and rhesus negative 15% of people. Organisms are distinguished. In medical practice, the rhesus factor is very important because it can lead to shock too. For example, if a rhesus negative person is repeatedly transfused with rhesus positive blood, then under the influence of the transfused rhesus agglutinogen, specific rhesus antibodies are produced in the blood, and the transfusion of rhesus-positive blood to this person can cause agglutination and hemolysis of erythrocytes, as well as possible blood transfusion shock. The rhesus factor is of particular importance for the course of pregnancy of women with a negative rhesus factor. In case of repeated pregnancy of such a woman from a rhesus-positive man, it can lead either to intrauterine fetal death or to the birth of a child with hemolytic jaundice of newborns. Blood coagulation system, vascular platelet hemostasis. We have two types of hemostasis, and first is vascular platelet. Stops bleeding in small vessels, and the mechanism consists of 4 stages. First, short-term spasm of the damaged vessels. It occurs reflexively as well as due to vasoconstrictive substances. Second, adhesion of platelets to the damaged wall. Yeah, they come into the damaged wall. It occurs due to the presence of receptors on platelets as well as due to changes in the charge of the vessel in the area of damage. At next step, stage 3, aggregation or crowding of platelets, while a homogeneous mass is formed. Platelets lose their structure. This reaction occurs under the action of thrombin. Biologically active substances, histamine, serotonin, blood clotting factors, and enzymes are released from platelets, which cause secondary vasospasm. The resulting platelet thrombus has a small number of fibrin filaments in the networks of which the shaped elements for are delayed retraction or complexion of the platelet thrombus due to the reaction of platelet thrombostenin. Blood coagulation system, the next one, it is a coagulation hemostasis. Yeah, there you see vascular platelet hemostasis, there coagulation hemostasis. In large vessels, it happened is caused by the transformation of soluble protein, fibrinogen, in plasma into insoluble fibrin. In this case, the thinnest strands of fibrin are formed in the loops of which blood cells and the liquid part of the blood are held. There are 3 stages. First stage, non-active thromboplastin, is released from destroyed tissue cells and platelets, which, under the action of calcium ions and blood clotting factors, turns into active thromboplastin. Second one, prothrombin, is a plasma protein that, under the action of active thromboplastin, calcium ions, and blood clotting factors, turn into thrombin. And soluble plasma protein, fibrinogen, under the influence of thrombin, calcium ions, and blood clotting factors, turn into fibrin. Then the fibrin thrombus is retracted due to the reduction of fibrin filaments, and the thrombus becomes denser and better closes the defect in the valves. The blood drained from the vessels begins to clot after 3–4 minutes, and after 5–6 minutes it completely turns into a dense clot. 3–6 minutes is the closing time of a healthy person. And the last system, what we need to talk, it is a blood anticoagulation system. Fibrinolysis is the melting of an existing thrombus. It starts simultaneously with retraction. It is carried out under the action of the plasma enzyme fibrinolysin. Anticoagulation heparin is formed in the liver and lungs, which prevents the formation of thrombin from prothrombin. Blood clotting factors, damage to tissues and shape blood elements, vitamin K, action of glucocorticoids, adrenaline and growth hormone, calcium ions, and hot outside the body. Sequence of measures before blood transfusion. Determine indication, contraindication. Determine the blood type and rhesus factor. Pick up the necessary blood. Determine its suitability for transfusion. Assemble and fill the transfusion system. Check the ropes for compatibility. Choose a transfusion method. Observing abscesses. Perform hemotransfusion. 8 factors. Check the ropes for compatibility. Compatibility test for the AB0 system. The determination of the blood type is based on the presence of an antibodies reactions. Uh, it is carried out using a standard serum containing known agglutinins. Blood is taken from a vein, about 5 milliliters. Centrifuged. Standard blood serum of groups 1, 2, and 3 is applied to the plate drop by drop into series. The examined blood is injected into them with a stick. The appearance of agglutination in serum indicates the presence of an agglutinogen antigens of the same name in red blood cells. For example, if agglutination occurred in the serum of group 2 containing beta-agglutinin and did not occur in the serum of group 3 containing alpha-agglutinin, then consequently there is agglutinin beta and no agglutinin alpha in the erythrocytes of the blood under study. Thus, is examined blood belongs to group 3. This video you can look in the link what is under. For rhesus factor compatibility, biological compatibility. Blood is poured into 10-20 ml times for minutes, a break of 3 minutes. Aches in the bones and other troubles. Stop the transfusion. Indications for blood transfusion: absolute, severe surgery, acute blood loss and shock, and relative: anemia, decreased immunity, intoxication, sepsis, blood clotting disorders, and bleeding. Contraindications: absolute myocardial infarction, acute heart failure, relative acute hepatic failure, renal insufficiency, heart defects, myocarditis, thrombosis, embolism, active tuberculosis, and violation of cerebral circulation. 8 relative contraindications. Determination of the suitability of blood for transfusion. Check the tightness of the container and the contents of the label. Visual evaluation of the contents of the container. When setting, the lower layer is shaped elements, between them is a layer of leukocytes. The upper layer is plasma. For example, a pinkish liquid may appear. Erythrocyte hemolysis has occurred. It cannot be transfused. Blood is checked for clots. Methods and types of blood transfusion. Direct blood transfusion, directly from the donor to the recipient through the device. I don't see it because it's not normally now. Indirect blood transfusion, transfusion of donor blood prepared in advance. Autohemotransfusion, transfusion of the patient's own blood. And cadaveric blood transfusion, there you can see rarely used, I never see it. Preservation and storage of blood. It is performed at blood transfusion stations or in blood transfusion departments. Blood source for transfusion. Gratuitous donor, a person from 18 to 60 years old healthy. Paid donors, same conditions. Once every 2 months you can take blood. Yeah, you can take money from your blood, you know. Immune donors, people who have had infection disease but they have developed antibodies. The container contains a blood stabilizer so that it does not curdle. Containers are hermetically sealed and stored into the refrigerator at a temperature of +4 + 6 degrees in an upright position on the bottom shelf. Shelf life depends on the method of canning and stabilizer indicated on the label. Carry out transfusion. On the eve of transfusion, a container with blood is taken out of the refrigerator in 40 minutes and heated at room temperature, sometimes heated in a water bath. Transfusion is carried out through a one-time use system, which is filled in compliance with all the rules. The transfusion rate is 4 drops per minute. You cannot transfuse blood from one container to two different recipients. You can transfuse blood from one container in parts. During the blood transfusion, it is necessary to monitor the patient's condition. An entry in the medical history after transfusion. You need to write indication for transfusion, date of transfusion, start time of transfusion, method and type of transfusion, data from the label, data on the recipient blood type and rhesus factor, data of compatibility tests, the patient's conditions before, during and after transfusion, temperature, pulse, blood pressure measured every hour. The first urine after transfusion is evaluated. At the end of the first day, a general urine test for protein and a clinical blood test are performed. After transfusion, the patient can be discharged no earlier than on the third day to store the remains of blood in a vial for 2 days. Blood components. We have erythrocyte mass, autologous blood, native erythrocyte mass, obtained as a result of separation of erythrocyte from gained blood. Erythrocyte suspension, plasma substitution solution are added to erythrocytes. Washed erythrocytes obtained from whole blood after plasma removal. Erythrocyte mass combined with leukocytes and platelets, platelet mass, leukocyte mass, and plasma. Blood preparations. Depending on their purpose, they are divided into complex purpose, immunological value, hemostatic value, anti-anemic value, and stimulation value. Albumin. In case of blood loss during the compensation of protein. Gamma globulin. Their use is aimed at the prevention and treatment of certain disease, tetanus, anti-staphylococcus infection. Fibrinogen with severe bleeding, surgical, gynecological, and practice. Hemostatic sponge is a topical preparation. Fibrinogen causes the melting of the existing thrombus. It is present in blood plasma, plasmin, and causes cleavage of fibrin bonds and blood clots. Blood substitutes are therapeutic solutions designed to replace lost blood functions. Anti-shock, the groups, yeah, anti-shock, polyglucine, real polyglucine, gelatinol. Detoxification, hemodialysis, neohemodialysis, polydialysis. Preparation for parenteral nutrition, protein hydrolyzers, a mixture of synthetic amino acids, fat emulsions, carbohydrates. Acid-base equilibrium regulators, crystalloid solutions like a Ringel solution, salt, disol, and others. Osmodiuretics, arbitol, mannitol, and others. Oxygen carriers, aerogel, and perphenol. Complications what we can have after the transfusion. Thrombosis and embolism, acute expansion of the boundaries of the heart, pyrogenic reaction, antigenic reaction, allergic reaction, blood transfusion shock, potassium, intoxication, infectious complications. That's all, guys, what I want to tell you in the lecture. It is a small information what you can take in your brain, yeah, to never forget this. But it is a small information. Um, when you start swimming, don't swim with the sharks because they will eat you. In there you have the same situation. I give you information, it's not big, but you need to remember in all of this. It is a basis. In the practice, we will talk about the sharks. Okay, thank you very much. See you later. Bye bye. Have a nice day.